At Hopkins, we're really pushing the field forward. We have such a huge faculty with so many different interests and specialties. We're one of the major institutions that are guiding the changes in policy and have pushed through most of the new research that we're seeing coming out about various infectious diseases.
What's special about Hopkins is we have an incredible breadth of expertise here working together. So we go from bench to bedside to the population. One of my projects is our Zero TB in Kids project, which is a study intervention really to eliminate tuberculosis in Tibetan refugees in India. And we've been very successful. We've reduced TB by 90% in Tibetan school children, which is just spectacular, and only in a few years.
My research is really around how do we do antimicrobial stewardship? How do we get people to prescribe antibiotics wisely? It's really critical that we do things now to address the rising rate of antimicrobial resistance. We are very used to having antibiotics available to treat bacterial infections, but we are progressing towards a world where we don't have those antibiotics available because of resistance.
There's 38 million people living with HIV, and treatments are very good. They completely stop the virus from replicating, but they don't cure anybody.
It was really our lab who did the definitive study with our Hopkins colleagues to show that this population of cells decays very slowly. That really laid the groundwork for understanding why you cannot take people off of antiretroviral therapy.
In terms of the research, I'm actually working on several projects really focused on trying to cure hepatitis B. So we have a couple of treatments that are available, but the problem with those treatments is that people need to take them lifelong for the most part, because if you stop the treatments, then the virus just comes back. And so we are interested in curing hepatitis B and doing some work to really understand more about what the virus is doing in the body and hopefully translate that into developing a cure.
We want to try to bring all the best innovative ideas together to solve global problems, increase or improve global public health. So for example, right now we know that about half of the world's population has no access to diagnostics. A lot of people just get empirically treated. You have fever, I give you a pile of pills. You have diarrhea, I give you a pile of pills. And instead of doing that, we want to help people move towards knowing what they have and getting the right treatment for what they have. In addition, diagnostic innovation without access is really not innovation at all. And so we want to try to marry those two things within the center, both here and abroad.
As it relates to tuberculosis care, as an example, the innovations that were designed here have now become more or less the standard of care across the US and increasingly across the world. The specific platforms that we built are now in more than 500 different public health departments providing care for tuberculosis patients. Our ventures into education and decision support now are freely distributed and used globally. You get to hear from the people that are doing the frontline research, but also who are the clinical experts in not just common diseases, but also really uncommon diseases.
I love understanding more about what's going on with hepatitis B. I feel like every day I come just a little bit closer to getting a hepatitis B cure.
Everyone deserves health care and good health care. It's our right as people, here and throughout the world.
The Infectious Diseases Division is just filled with remarkable people. They are all in on taking care of patients in the hospital, and I love that.
Anything that I've ever needed on a research project has sort of found itself in Hopkins because there's so many connections here, and it has just been such a pleasure to be involved in this community.
It's nice to be able to work on something that you know is really important and where you know that you can make a difference. And so at the end of the day, if you've made a difference, you can't ask for anything better.